Have you ever stopped to think about how your bathing habits might actually be harming your skin, your health, and even your longevity? Ladies, you may believe you've nailed down your bathing routine, but what if I told you that by the time you're over 70, everything you've been doing could actually be speeding up the aging process? From making your skin look older to raising your chances of infections, many women over 70 are unknowingly making key mistakes. Stick with me until the very end, because I'm about to share 8 shocking facts about bathing after 70 that could completely change how you take care of yourself. And trust me, you won't want to miss any of them if you care about staying youthful and healthy in your golden years. Before we dive in, do me a quick favor and give this video a thumbs up if you find it helpful. That small gesture helps me continue spreading important lessons about aging gracefully. And if you're not subscribed yet, hit that button and turn on the bell so you never miss any of these valuable insights. And of course, feel free to leave a quick comment. If you liked the video, type a 1, and if not, a 0 will do, so I can improve my content for you. Now, let's get into it. Fact 1. Bathing too often can actually speed up skin aging. Here's a quick question for you. How often do you find yourself in the shower or sinking into a bath? Is it a daily habit, maybe even twice a day, because you've been taught that cleanliness is crucial? Or maybe you go for a bath every other day, just enough to keep yourself fresh without overdoing it. Whatever your routine is, here's something that might surprise you. If you're over 70 and still bathing every single day, you might be unknowingly speeding up your skin's aging process. It might sound shocking, but what you've thought of as a healthy habit could actually be working against you. Let's break down the science and see why this happens. As we get older, our skin goes through significant changes. It thins, it loses that youthful plumpness, and it becomes more fragile, like something delicate you'd handle with great care. The natural oils our skin produces, known as sebum, act as a protective barrier, locking in moisture and keeping our skin looking soft and smooth. But as we age past 70, that protective barrier weakens, making your skin more vulnerable than before. Now, picture this. Every time you wash with soap and hot water, you're not just rinsing off dirt. You're stripping away the last remnants of your skin's natural protection. Imagine your skin as a delicate flower, once vibrant and full of life. When you were younger, daily baths might have been refreshing, even necessary. But as we get older, that flower turns into something more fragile, like a fine piece of lace. You wouldn't be rough with lace, right? Yet many of us unknowingly treat our aging skin the same way, scrubbing away too hard, using scalding water, or applying harsh soaps. But don't worry, there's a way to protect yourself while still staying clean. Experts in dermatology agree. For women over 70, a full body bath or shower is typically only needed about 2 to 3 times a week. That's right, 2 to 3 times, not 7. On the other days, a quick wash of the key areas, underarms, feet, and intimate areas, does the job just fine. This way, you're staying fresh without overloading your skin. But it's not just the frequency that matters. The way you bathe plays a huge role. Many of us reach for heavily scented soaps, the kind that lather up and leave a nice fragrance. Or we indulge in long, hot showers because they feel like a treat. But here's the problem. Those habits are harsh on aging skin. Scented soaps packed with chemicals or perfumes can rob your skin of moisture, while hot water soaks up all the natural oils your skin needs. The result? Dry, irritated skin that ages faster than it should. So, what's the solution here? Dermatologists recommend making the switch to gentle, fragrance-free cleansers. Think mild, soothing formulas that cleanse without stripping away moisture. And when it comes to water temperature, aim for lukewarm, not scalding hot. Try to keep your showers short, 5 to 10 minutes max, so no more long indulgent spa sessions like when you were younger. If you've been bathing the same way you did in your 20s, it's time to reevaluate your routine. Your skin's not the same anymore. It's evolving, and it's up to you to adjust and protect it. If you're still with me and finding these tips helpful, let me know in the comments by typing Number 1. And if you haven't subscribed yet, hit that subscribe button and ring the bell so you never miss out. Your support helps me continue bringing you valuable, life-changing insights. Now, let's keep going. Fact 2. Overbathing could increase your risk of infections. If the idea that too much bathing could age your skin was a bit of a shock, brace yourself. This next fact is going to turn your world upside down. What if I told you that frequent bathing could actually make you more prone to infections? Sounds crazy, right? After all, we've been taught that washing is the ultimate defense against germs. But there's more to the story, and I promise it's worth sticking around for. Your skin isn't just an outer shell. It's an active, living barrier, a fortress that keeps harmful bacteria, fungi, and other nasty invaders at bay. And the key to that defense is two things: your skin's natural oils and its microbiome. Let's break it down. Your skin is naturally coated with oils that act as a protective layer, keeping moisture in and bacteria out. But there's more. Your skin also hosts a whole ecosystem of beneficial bacteria, which help protect you from harmful microbes. These microorganisms create a healthy microbiome, keeping harmful invaders in check. But here's the catch. Every time you scrub with harsh soaps or linger in hot water, you're not just cleaning your skin. You're erasing that protective barrier. You're washing away the oils and disrupting the delicate balance of good bacteria that keep you safe. It's like tearing down the walls of your home and leaving the door wide open for invaders. For women over 70 whose skin is already producing fewer oils and is slower to recover, this becomes a big problem. What kinds of issues can crop up from overbathing? Let's take a look. Fungal infections like athlete's foot or yeast infections thrive when your skin's protective barrier is weakened. Eczema and dermatitis can also flare up, turning your skin into an inflamed, itchy mess. And because your skin's natural defenses are compromised, bacterial infections are more likely to take hold. Without that protective shield, even tiny cuts or cracks in the skin can let harmful bacteria in, leading to serious issues like cellulitis, an infection that requires medical attention. You might think, I'll just use antibacterial soap, but that can backfire. While antibacterial soaps might kill some bad bacteria, they also wipe out the good ones, throwing your skin's ecosystem into chaos. Some ingredients, like triclosan, found in these products have even been linked to antibiotic resistance over time, something you don't want to deal with. So next time you feel the urge to bathe again, stop and think, is your skin begging for another wash, or is it asking for a break? By cutting back on overbathing and preserving your skin's natural oils and microbiome, you'll do more than avoid dryness. You'll empower your skin to do its job and keep you healthy. Hot showers, a hidden danger for seniors. For as long as I can remember, nothing felt better than a long, hot shower. The steam fills the room, the warmth envelops you, and you step out feeling refreshed and pampered. But here's a reality check. Once you hit 70, that hot shower could go from being a comforting ritual to a potential safety hazard. And it's not just about the warmth anymore. It's about the risks to your health. Let me explain why. Hot water causes your blood vessels to expand in an effort to cool down your body. This is a normal response, but here's the catch. As your blood vessels dilate, your blood pressure drops. For younger people, the body adjusts quickly, but as we age, our systems aren't as responsive. When your blood pressure drops too quickly, it can cause dizziness, lightheadedness, or even fainting. Now imagine this. You're standing in a slippery bathroom, surrounded by wet tiles. If you lose your balance for even a second, the consequences can be disastrous. Did you know that more than 80% of falls among seniors happen in the bathroom? That's not a coincidence. The combination of slippery floors, foggy mirrors, and a sudden drop in blood pressure can create the perfect storm for a fall, one that could change your life in an instant. And the stakes are even higher when you're over 70. A fall isn't just an inconvenience. A broken hip can require surgery, long rehab, and sometimes even a loss of independence. A head injury could lead to concussions or worse. Even if the injury seems minor at first, the long-term effects can be debilitating. A single misstep in the shower can set off a chain of events that alters the course of your life. So, the next time you're about to step into a hot shower, ask yourself, is the risk worth it? By switching to a cooler, shorter shower routine, you can keep your body safe and your bathroom accident-free. It's all about taking control of your health as you age, making small adjustments to keep you feeling vibrant, safe, and healthy for years to come. If you're someone who loves that super hot shower or know a senior who does, here's how to enjoy your bathing ritual without compromising safety. First things first, turn the heat down a little. Aim for a temperature that feels comforting, not scalding. If your skin is turning red, it's a sign the water is too hot for your body to handle. Then make your bathroom a safety haven. Install grab bars around the shower, places you can hold on to in case you feel unsteady. Consider a shower stool or chair so that you can sit down and turn your shower into a stress-free, safe experience. And one last tip. If you start feeling dizzy or lightheaded mid-shower, don't tough it out. Sit down or lower yourself to the floor immediately. Breathe slowly, and if you don't feel better right away, don't hesitate to call for help. Your safety is far more important than pushing through a moment of dizziness. Drop a comment saying number 2 below if you're still with me. And if you haven't yet subscribed, I highly recommend hitting that subscribe button and turning on notifications so you never miss out on our videos. Your support keeps us motivated to create more content that informs and inspires. Now, let's move on. Fact 4. Don't forget about your feet. We're all used to giving attention to our faces, moisturizing, using serums, and maybe even splurging on eye creams to keep things looking fresh. But how often do we show our feet the same care? Most of the time, they're an afterthought, quickly washed in the shower or saved for a pedicure every few months. But as we age, our feet deserve more than just a passing glance. Poor circulation can make your feet more vulnerable, slowing down the healing process for even small cuts or scrapes. When you skip proper foot care, bacteria and fungi can thrive in the damp, warm spaces between your toes. Not only does this lead to unpleasant odors, but it can also invite infections. Fungal issues like athlete's foot become far more likely when feet aren't properly dried after a shower, especially if moisture is left to linger in the cracks. The risk is even higher for seniors with conditions like diabetes or compromised immune systems. Moist, neglected feet can lead to painful, slow-healing ulcers that require medical treatment. And let's not forget those toenails. Trimming them properly is key. Cut straight across, avoid cutting them too short, and give your nails the attention they need to stay healthy. Neglecting this can lead to ingrown toenails, which open the door for infections to sneak in. So even if you're only showering a couple of times a week, your feet need daily care. Here's a simple routine to follow. Wash them gently every day, even on the days you skip a full shower. Use mild soap and warm, not hot, water, and take your time to scrub away dirt and sweat. But don't just wipe them dry with a towel. Take a moment to pat them dry, especially between the toes. Moisturize the tops and soles to keep the skin from cracking, but skip the lotion between the toes to avoid excess moisture that breeds fungus. And here's one last piece of advice. If your feet start to ache, swell, or tingle, don't ignore it. These could be signs of poor circulation or nerve issues, something that becomes more common with age. A quick visit to the doctor might catch things before they get serious. By giving your feet this regular TLC, you're not just avoiding infections. You're making sure they continue to carry you through life comfortably and pain-free for many more years. Fact 5. Your intimate areas need a different kind of care. Let's talk about something that doesn't always come up in casual conversation, but is incredibly important for women over 70. How to care for your intimate areas. As we age, these areas undergo significant changes, and if you're still using the same care methods you relied on when you were younger, you could be creating more problems than you realize. After menopause, many women experience a decrease in natural lubrication, which can make intimate areas more prone to dryness, irritation, and discomfort. This is the perfect storm for things like recurring infections, urinary tract infections, UTIs, or uncomfortable itching. So, what should you be doing differently? Start with gentle, fragrance-free products that are specifically formulated for sensitive areas. Avoid using harsh soaps or anything with strong scents, as these can disrupt the delicate balance of your intimate skin. And just like you would with your feet, make sure to keep things clean and dry. After showering, use a soft towel to pat the area dry, and consider applying a moisturizer designed for intimate areas to combat dryness. Finally, if you notice any unusual irritation, discomfort, or itching that doesn't go away, don't hesitate to talk to your doctor. It's always better to address these issues sooner rather than later. Fact 4. Your feet deserve more attention than you think. We all spend time pampering our faces, right? A little moisturizer here, a dab of serum there, maybe even some luxurious eye cream to keep the dark circles at bay. It's a self-care ritual we don't skip. But here's a question. When was the last time you gave your feet that same level of love and care? Let's be honest, we often overlook them. We may wash them quickly, maybe get a pedicure here and there, but it's about more than just occasional maintenance. Your feet are the foundation of your mobility, and they deserve consistent attention, especially as we age. As you grow older, circulation in your feet can slow down. Blood flow just isn't as efficient as it used to be, and that means minor cuts and scrapes might take longer to heal. Those small injuries can become bigger problems, making your feet a target for infections if not properly cared for. Here's the tricky part. If you're not drying your feet properly, moisture can linger between your toes, creating the perfect environment for bacteria and fungi. Fungal infections like athlete's foot thrive in this damp, neglected space. If you're not careful, you may notice itching, redness, or even peeling. For seniors, especially those with diabetes or weakened immune systems, that moisture could lead to ulcers, painful, slow-healing sores that need medical attention. And let's talk about toenails. If they're not trimmed well, they can become ingrown, creating even more opportunities for infections. Suddenly, those feet you rarely think about become a health hazard. Here's a simple daily routine to keep your feet healthy. Wash them every day. Even if you're not showering, give them a good rinse in a basin with mild soap and warm water. Dry them thoroughly. Pat them gently, especially between the toes. Those small corners are where trouble hides. Moisturize the tops and soles, but skip between the toes to avoid excess moisture. Check for signs of discomfort. If your feet start to swell, ache, or tingle, don't ignore it. These could be signs of poor circulation or nerve issues. A quick chat with your doctor could help. Your feet are meant to carry you for years, so give them the TLC they need. If you're still here, comment number 2 below and let me know. Also, don't forget to subscribe and hit the bell so you won't miss out on more helpful videos. Your support helps us continue making content that informs and inspires. Let's keep going. Fact 5. Your private areas need extra care too. Now let's dive into a topic that's often avoided but is incredibly important: your intimate health. For women over 70, this area requires special attention, and failing to adapt your routine could result in uncomfortable, even painful, consequences. Here's why. After menopause, estrogen levels dip dramatically, and as a result, your vaginal tissues can become thinner, drier, and more sensitive. What used to be a minor irritation, like using a strong soap, can now lead to burning, stinging, or redness. Additionally, your vaginal pH balance shifts over time. It used to be naturally acidic, acting as a defense mechanism against bacteria and yeast. But as estrogen levels drop, that acidity weakens, and your pH balance moves toward a neutral level. This can increase the risk of infections like bacterial vaginosis or yeast infections, especially if your hygiene routine isn't adjusted to reflect these changes. The skin around your intimate area also changes. It becomes more fragile, losing collagen and elasticity, almost like paper. This means harsh soaps, aggressive scrubbing, or rough washcloths can tear the skin, leading to irritation and infections. Let's talk about common mistakes that many women make when caring for this area. If you're still using strong antibacterial soaps, floral-scented body washes, or, worst of all, douching, you're actually doing more harm than good. These products strip away the good bacteria, like lactobacilli, that help maintain a healthy balance in your vagina. Douching, in particular, can push bacteria deeper into the reproductive tract, increasing the risk of infection. So, What's the right way to care for this sensitive area? The vagina is self-cleaning and it doesn't need much help. For the external area, use warm water. That's usually enough to keep it clean. If you feel the need to use a cleanser, choose something mild, fragrance-free, and hypoallergenic. Avoid the loofahs or rough washcloths. Your hands are the gentlest tool. After washing, resist the urge to rub with a towel. Instead, gently pat dry with a soft cloth. This minimizes friction and avoids irritating the skin. Here's a surprising fact. Overwashing can actually make things worse. You might think more scrubbing equals a fresher feeling, but too much washing disrupts the balance, killing off the good bacteria that keep odor at bay. If you've ever felt less fresh right after showering, it's a sign that your routine might need adjusting. The golden rule, less is more. A simple, gentle approach keeps everything balanced, and your body can do what it was designed to do. If you're still watching, comment number 3 below and let me know you're here. Don't forget to subscribe and hit the bell so you won't miss out on more valuable content. Your support helps us continue creating useful videos that inform and inspire. Now, on to the next topic. Fact 6. Hard water is sneaky, but it's ruining your skin and hair. Let's talk about something most of us overlook: the water you shower with. You might be doing everything right in terms of skincare and hair care, yet your skin feels tight, itchy, or scaly after you step out of the shower. Or maybe your hair looks lifeless, no matter how much conditioner you use. The culprit? Hard water. It's packed with minerals like calcium, magnesium, and sometimes iron. These minerals might be causing problems you didn't even know were related to your water supply. When you shower, those minerals leave a thin, stubborn residue on your skin. This soap scum blocks pores, dries out your skin, and leaves it feeling rough. If you suffer from conditions like eczema or psoriasis, hard water can make flare-ups worse, leading to intense itching and irritation. But the damage doesn't stop at your skin. Hard water affects your hair too. It deposits minerals onto your scalp and strands, weighing hair down and making it look dull and flat. Over time, your hair can become brittle, dry, and prone to breakage. If you're already noticing thinning hair, this could be making things worse. If you found this video helpful, comment number 4 below and let me know. Also, hit subscribe and the bell so you don't miss future tips. Your support means a lot to us as we continue bringing you valuable content. The good news, you don't have to accept the harshness of hard water any longer. There are practical steps you can take to fight back and restore your skin and hair's natural balance. Start with a shower filter, a simple, budget-friendly device that easily screws onto your shower head. It works by trapping those stubborn minerals before they have a chance to harm your skin and hair. You can find them at most hardware stores or online. And once you have one in place, get ready for softer skin, fewer irritations, and lighter, more manageable hair. Next up, rethink your cleanser. Bar soap might seem like a good option, but it reacts with hard water to form extra scum, making the problem worse. Instead, go for a gentle, pH-balanced body wash, or a moisturizing cleanser designed to clean without leaving residues behind. And here's a key trick. Don't let your skin air dry after your shower. Waiting allows those minerals to settle in. Apply a rich moisturizer while your skin is still damp, within 3 minutes of stepping out, to lock in hydration and protect against that hard water dryness. Bonus tip: if your hair is suffering from mineral buildup, try a weekly clarifying shampoo followed by a deep conditioner. It'll restore softness and give your hair a fresh start. While you might not control your city's water quality, these little changes can help shield your skin and hair from the harsh reality of hard water. Fact 7. Taking a warm bath before bed can actually help you sleep better. If restless nights have become a routine for you, trouble falling asleep, staying asleep, or waking up feeling like you didn't sleep at all, there's a simple, effective fix: a warm bath before bed. And no, this isn't just an excuse for a pamper session. This is a scientifically proven technique to help your body and mind relax for a better night's sleep. Now, you might be thinking, wait, didn't you warn us against hot water earlier? You're absolutely right. Hot showers or baths can pose risks, especially as we age. But the key here is warmth, not heat. A lukewarm bath, think around 98 to 100 degrees Fahrenheit, can soothe your body and help ease you into sleep. Here's the science. Your body naturally cools down in the evening to signal that it's time to sleep. A warm bath gently raises your body temperature, and then as you step out, your core temperature drops quickly, mirroring your natural evening dip. This rapid cooling process triggers your brain to release melatonin, the sleep hormone, helping you fall asleep faster and sleep more soundly. Beyond temperature, a warm bath can work wonders for your physical and mental health. It relaxes your muscles after a long day, especially if you've been on your feet or sitting for hours, and it eases joint pain, a common sleep disruptor. It also helps calm stress and anxiety, which can interfere with sleep, particularly as we get older. The warm water activates your parasympathetic nervous system, lowering cortisol levels and bringing a deep sense of calm. To get the most out of your bath, time is crucial. Aim for 1 to 2 hours before your bedtime. Bathing too close to sleep won't give your body enough time to cool down. For a little extra relaxation, try adding a few drops of lavender essential oil to your bath water. Its soothing scent can slow your heart rate, reduce muscle tension, and quiet your mind. Pair this ritual with a bedtime routine. Dim the lights, read a good book, and you've got the perfect setup for a restful night. If sleepless nights have been your reality, this simple, low-cost tweak could be just what you need for better, deeper sleep. If you're still watching and finding these tips helpful, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, hit that subscribe button and turn on the bell so you never miss our latest videos. Your support helps us continue creating valuable content. Let's keep going. Fact 8. Your bathing habits could have an impact on your heart health. Surprised? It's true. What you do in the bath can actually affect your heart, especially after 70. You may not think of your daily shower or bath as a health risk, but for those with high blood pressure, heart disease, or circulation issues, your bathing habits could either be supporting or straining your cardiovascular system. Aging naturally affects your heart, and small choices, like water temperature or how long you soak, can have a huge effect. Let's look at the risks. Sudden temperature changes are the biggest concern. A bath that's too hot, above 104 degrees Fahrenheit, causes your blood vessels to dilate quickly, which can drop your blood pressure, leaving you feeling dizzy, lightheaded, or faint, especially dangerous if you're alone. On the flip side, ending your bath with cold water can make your blood vessels constrict fast, which increases your blood pressure and forces your heart to work harder. While this might be okay for younger, healthier hearts, it's definitely a risk as we age. Then there's the danger of soaking for too long. Staying in hot water for 20 to 40 minutes might feel luxurious, but it further dilates your blood vessels, decreasing the efficiency of your blood flow and oxygen delivery. The result? You could feel lightheaded, short of breath, or foggy, signs that your body is under stress. To protect your heart while bathing, it's all about being mindful. Stick with warm water, 98 to 100 degrees Fahrenheit, avoiding extremes. Limit your soak to 10 to 15 minutes, just long enough to relax but not too long to overtax your system. When getting out of the bath, don't rush, stand up slowly, hold on to something sturdy, and give your circulation time to adjust. If you're using a bath-shower combo, sit on a bath chair for added stability. And most importantly, listen to your body. If you feel faint or weak during your bath, stop right away, get out, and rest. Your heart has been with you for decades. Taking a few mindful steps in the bath can help keep it going strong. So, there you have it. We've covered 8 surprising facts about bathing after 70, from how hot showers can age your skin to how a warm bath before bed could improve your sleep. I hope you feel empowered to make these simple yet powerful changes to your routine. Now, I'd love to hear from you. What stood out to you the most? Maybe it's switching up your bathing habits, giving your feet some extra love, or choosing gentler cleansers for your skin. Whatever it is, leave me a comment below and share what you plan to try first. Small changes truly do make a big difference. If this video helped, please drop a comment, hit like, share with someone who could benefit, and subscribe so you don't miss out on more tips to help you live your best life. Thank you so much for watching, and I'll see you next time. Until then, take care of yourselves. You absolutely deserve it.